All right, time for our weekly Health Watch with Dr. Syed Hussain from Trinity Health of New England, who will get the hygienic fist bump from. How are you, sir?
I'm good, thank you, Tim.
Good, good. Listen, this is a story that's probably going to raise a lot of eyebrows, including in my household. Both my boys diagnosed with ADHD, and a new study has suggested that people with ADHD wind up having shorter lifespans. And this is affecting, what, 22 million adults and children in the United States. But there is a but here that I think is important.
Yeah, let's talk about this. So this is a large study coming out of the UK. Tim, globally, there about 2.8% of the population has attention hyperactivity disorder, attention deficit hyperactivity disorder in adults. It may start in children, but may then carry on into adulthood. And what this means is that we need to put more interventions in place to address some of the things around these individuals. They have poor access to health care. There are disparities that these individuals may experience. And what this study found was in males, a little over 6 years less lifespan, and females, a little over 8 years less, compared to those individuals that do not have ADHD. It's not generally linked directly to ADHD per se, but like I said, these folks are, because of various reasons, they are higher risk of developing high blood pressure and diabetes and neurological conditions, depression, anxiety, not having that social support system, not having access to healthcare. So it's really, that's why I go back to the first thing that I just said, that we need to do more in healthcare to build interventions and programs around these people to provide those services and that support that they need.
So it's kind of like just a correlation, but maybe it could be causative if you're just looking at multiple steps.
That's
like
right.
ADHD leads to this, which in turn could lead to a shorter lifespan.
Exactly.
That kind of thing. Okay. The Food and Drug Administration has approved a nasal spray to treat depression. It's called Spravato. It first came on the market 5 years ago to treat cases of depression, but only alongside an oral antidepressant. So what has changed?
Yeah, the fact that the FDA looked at over 31 studies, Tim, there's a large Johnson & Johnson phase 4 clinical trial data that they looked at and basically said, what's changed from 2019 is now this can be used as monotherapy. And in patients who have tried at least two oral antidepressants and they still are refractory or still experiencing symptoms. And so this is promising based on data that we've seen since 2019 in patients. Some of these patients can respond within 24 hours. It looks like it's a bi-weekly dose, but all of that will depend on each patient and their interaction with their psychiatrist, but promising nonetheless. Is one of the first drugs to be approved in new drug in decades.
Yeah, good to see some good news there. Hopefully it will help a lot of people. All right, last thing we want to talk about here, a strain of the bird flu, a new one. We're not talking about H5N1, which is the strain of the bird flu we've been reporting on. This was, I believe, H5N9, and it was found in a duck farm on California. Maybe we should talk about both. Start with H5N9. What do we know?
Yeah, that's the more prevalent strain. This new strain, more to be researched and looked into, but it appears to be a newer type of
the N9.
Bird flu. It belongs to the same category, though, Tim.
Yeah.
And in this particular farm, as of December, there were 119,000 birds that were culled because of the H5N1 outbreak. So suffice to say, it's really, really important to keep an eye on this. I know there's state public health officials, et cetera, that are involved in making sure that this is looked into.
Yes.
But that surveillance needs to continue as we progress through this flu season.
The big question, which of course you can't answer, is it ever going to be human-to-human transmission? Not yet. No signs yet. But are we starting to see signs that that probability is going up?
No, I don't want to alarm people by saying that, Tim. Like I said, we need to keep an eye on it. That's the biggest fear, that it would make that evolutionary jump to go from human to human easily. Yep. And that's what we need to look out for.
Just keep looking. Unfortunately, some questions.
And by looking, I mean making sure that folks are tested. Yes. Especially when they come down with influenza.
Right. Okay. I know so many birds have killed. This has led to those egg prices jumping like we've talked about, so it's all sort of interrelated. Doctor, thank you so much for joining us today.
Thank you.
A pleasure to have you as always. Symphony